Hello, dear students. Welcome back to my channel Learn with Professor Janula. In this video, we will discuss OSCE Examination Station 1, which is about interpreting an investigation report. In this station, you will be given a patient's laboratory or diagnostic report, and your task is to carefully read and analyze the findings. You should first identify the patient details, the type of investigation performed, and the values reported. Then compare the patient's results with the normal reference values to identify any abnormalities. After that, interpret what these abnormal findings may indicate about the patient's condition. Finally, you should clearly explain the possible clinical significance and communicate your interpretation in a structured and professional manner. This station mainly assesses your knowledge, critical thinking, and ability to interpret investigation results accurately. Students, let us first look at the patient details provided in this OSCE station. The patient's name is Mrs. Radhika, and she is 29 years old. Her obstetric history shows G2P1, which means she is in her second pregnancy and has previously delivered one baby. The gestational age mentioned here is 26 weeks, which indicates that she is currently in the second trimester of pregnancy. These details are important because many investigations and their interpretations depend on the patient's age, obstetric history, and stage of pregnancy. Therefore, before analyzing any investigation report, always start by carefully reviewing the patient's basic details. Students, now let us examine the investigation report provided in this station. The test performed is the oral glucose tolerance test, commonly known as OGTT, which is used to diagnose gestational diabetes during pregnancy. First, look at the fasting value. The patient's result is 102 milligrams per deciliter, whereas the normal value should be less than 95 milligrams per deciliter, so this is elevated. Next, the 1-hour value is 185 milligrams per deciliter, while the normal value is less than 180 milligrams per deciliter, which is also higher than normal. Finally, the 2-hour value is 165 milligrams per deciliter, whereas the normal value should be less than 155 milligrams per deciliter, again indicating an elevated level. Since all these values are above the normal range, the findings suggest that the patient is likely developing gestational diabetes mellitus. Student tasks. Question number 1. Identify the abnormal values in the investigation report. Question number 2. Name the condition based on the findings. Question number 3. Mention the appropriate dietary advice for the patient. Students, let us now identify the abnormal values in this investigation report. The fasting blood glucose level is 102 milligrams per deciliter, while the normal value should be less than 95 milligrams per deciliter, so this is elevated. The 1-hour value is 185 milligrams per deciliter, which is higher than the normal limit of less than 180 milligrams per deciliter. The 2-hour value is 165 milligrams per deciliter, which is also above the normal value of less than 155 milligrams per deciliter. Therefore, all three readings in this OGTT report are higher than the normal range, indicating abnormal glucose tolerance during pregnancy. Students, after identifying the abnormal values, the next step is to name the condition. Based on the elevated OGTT values, the condition is gestational diabetes mellitus, commonly known as GDM. Gestational diabetes mellitus refers to glucose intolerance that first develops during pregnancy. It is usually detected during the second trimester, particularly between 24 and 28 weeks of gestation, when screening tests like the oral glucose tolerance test are commonly performed. Students, the final task is to provide dietary advice for the patient. For a mother with gestational diabetes mellitus, proper diet plays an important role in controlling blood glucose levels. The patient should be advised to eat small and frequent meals instead of large meals to maintain stable blood sugar levels. She should include high-fiber foods such as whole grains, vegetables, and fruits in her daily diet. At the same time, it is important to limit simple sugars such as sweets, cakes, sugary drinks, and desserts to prevent further rise in blood glucose levels. Students, in addition to the previous advice, there are some more important dietary recommendations for a mother with gestational diabetes. The patient should choose complex carbohydrates such as brown rice, whole wheat, and oats, which help in maintaining stable blood glucose levels. Adequate protein intake is also important, including foods like eggs, pulses, lean meat, and milk. She should avoid fried and high-fat foods as they can contribute to unhealthy weight gain and poor glucose control. It is also important to maintain regular meal timing and avoid skipping meals. Finally, the patient should drink adequate water and follow the specific diet plan recommended by the healthcare provider to ensure both maternal and fetal well-being. Thank you for watching this video. If you found this helpful, please like, subscribe, and comment for more learning videos.